Public health crisis that not enough people are talking about.
Yeah, a new study highlights just how pervasive lead exposure is among Cleveland's children. Cleveland Clinic officials say it reinforces the need for one of their mobile programs. News 5's Jordan Vandenberg is in the Tech Center to explain how it all works, Jordan.
Well, the federal government banned lead paint more than 4 decades ago. But for the small team aboard the Cleveland Clinic's school-based health mobile unit, they see its impact still to this day.
Here in the back of a school parking lot, the hospital comes to you.
These are my alcohol wipes there.
This is the Cleveland Clinic's school-based health mobile unit. And along with wellness checks and immunizations, the tight-knit team can also do blood draws for the testing of lead.
Any level of lead is unsafe for a child, and the reason it's unsafe is it can lead to issues with brain development and motor development, and the children are still developing. So this is why this is a bigger issue for children than for adults.
And there's no reversing it. A new study by Case Western Reserve University shows 25% of CMSD kindergartners are dealing with the direct effects of lead exposure, a majority of which come from the city's poor neighborhoods. Lead can stunt a child's growth, development, and performance in the classroom.
Lead has a distinct and negative impact, and it plays out in many of the civil systems that cost us, as taxpayers, tremendous amounts of money.
The study also found that not enough children are getting tested. The clinic wants to change that.
That's why we have a program in which we're reaching out to the Head Starts in Cleveland to have a lead program, so that we're going out to the Head Starts while the kids are 3, 4 years old to get their lead checked, so we can identify anyone with lead exposure early on.
Lead exposure in Cleveland typically comes from paint that's peeling off of the city's aging and deteriorating housing stock. To help the team help their patients, the mobile unit also features software that alerts them to whether the patient comes from a high lead neighborhood.
Yeah, I think anytime you have a child faced with any adversity, it's hard, which is why we're here and why we do what we do, so that we can reach out to those families and help them.
And Money says so far this year, the mobile unit has tested more than 3 dozen children. In the Tech Center, Jordan Vandenberg, News 5.